Are you thinking of having a home birth? Let's look at the criteria that you can give birth safely at home. So according to the American College of Nurse Midwives, if you are well and you're having a healthy pregnancy, then you can give birth really anywhere at the hospital birthing center or home if you have qualified providers with you. So let's look at some of the specific criteria. So to safely give birth at home, the baby needs to be in a head-first position at full term. Labor needs to start between 37 and 42 weeks. Before 37 weeks would be preterm. And then after 42 weeks, there is a higher risk of complications. Also, she needs to have spontaneous labor, so no medical reason for induction. And there should be a normal amount of amniotic fluid and no prior C-section. Also, mom should have no problems with high blood pressure or diabetes before pregnancy or developing during the pregnancy. So that means no preeclampsia, no gestational diabetes. Also, we should only have one baby. If there's twins or triplets or more, then they cannot safely be born at home. Now, do you want to be prepared and not scared for childbirth? Just look in the description. I do have a link to see how you can get a discount for my childbirth education classes. So what if mom is healthy, but then something comes up before or during labor that she would need to be transported or transferred to a physician care or to the hospital? Some examples of those could be that maybe the midwife realizes the baby's in a breech position, or something comes up that there's a medical reason for labor induction, like mom does develop preeclampsia, or if she is in labor at home and labor is not progressing, that could be a reason to be transferred to the hospital. If there's something with the fetal heart rate that's abnormal, or if after the baby's born and then she's hemorrhaging, which is losing too much blood afterwards. Those are all reasons that she would need to be transferred to the care of a provider in a hospital setting. So in order to safely transfer that mom to the care that she needs, at the very beginning of the prenatal care with that midwife, the client and the midwife would get together to come up with a plan of if there is a need for transfer or transport. So they would come up with a plan of who the provider would be that they're going to transfer care to and the location of the hospital. And that allows for better communication between the providers and then that safe transfer of care. Okay, this video is part of my home birth series. Please watch the next one, Home Birth Midwives, looking at the credentials of different type of midwives that can attend you at home.